Hi, I'm Dr. Melissa Hughes. I'm a forensic psychologist and a clinical neuropsychologist with a particular interest in brain injury and brain impairment, particularly in forensic contexts, both criminal but as well as civil and medico legal. In layman's terms, I look at cognitive functioning, so that's different areas of thinking skills, so things like memory and attention, using scientific best practice and methods, including a big battery and a range of standardized tools and tasks to look at how someone's brain is working, what sort of impairments they might be having, and how that might relate to a specific injury that's either that's known or a suspected injury. I became interested in neuropsychology after studying psychology and really getting a feel for neuroscience and how the brain works and how much there is to know and how much we don't know. I was also particularly interested in the crossover with forensic psychology and the role of brain impairment in a range of different forensic contexts and legal matters. So in regards to personal injury assessments, I see a wide range of people where there's been known or suspected injury to the brain. So commonly this is in acquired brain injury. So that's an insult to the brain. So as opposed to say something neurodevelopmental or a neurodegenerative disorder, although I do also see those. But in personal injury, I see a lot of traumatic brain injury. So that's where there's been a mechanical force to the head, such as in a car accident or a workplace fall. But it can also happen such as in a stroke or with high exposure to a toxic substance, so even alcohol. So I have seen people who have had acquired brain injury from alcohol and substance use in a workplace setting as well. So it was about whether they had a brain injury first and foremost, what that brain injury looked like, and how that brain injury was impacting on their ability to do their role. So the role I play is I conduct a comprehensive assessment. So we review collateral records from a range of different sources, such as if there are any ambulance or hospital records, as well as information from employers or other allied health professionals, MRI scans, pathology results. We look at what's happening, the broader context, as well as conducting an interview with the client about the kinds of problems that they're experiencing day to day with their thinking skills, as well as the problems that they might be having in the workplace or just general life. Then we conduct a long series of tests, so things looking at cognitive abilities such as memory, attention, higher level skills such as decision making and planning, and that's using standardized assessment tools that I mentioned before. I'll then, after seeing the client, I then score up these tests and I put them into context with all of the other information I've got to look at diagnostic factors, as well as the likely prognosis, as well as treatment needs. And the importance of this is really minimizing the likelihood of misdiagnosis. So say someone seems to have some problems with their memory and they come to see me, is that a depression or something related to something else going on in their life, or is it an actual brain injury? Because this has important indications for what their treatment needs are, so that claims can be settled more efficiently and the clients can get the treatment that they need so that they can be well on their way to return to the maximum level of functioning as possible, and return to work or whatever the case may be in that individual situation. So I've seen individuals from a range of industries, so from people in the finance sector to construction workers having a fall. what I find really interesting about this is I've learned a lot about how different sectors operate and the work, and which has been quite interesting. But what I've also found quite interesting is just the impact that brain injury, whether minor or more severe, can have on the functioning and someone's ability to do their job. So I'm always happy to have a chat with someone about whether neuropsychology can assist them. If you're not sure whether this is more in the realms of neuropsychology or clinical psychology or psychiatry, I'm always happy to have that chat, because sometimes it can be really hard to know whether neuropsychology is or isn't indicated. I mean, there's some times when it's very clear. There's other times when you're not sure what's going on for this person. Is it psychiatric? Is it psychological? Is there some brain injury? And sometimes it might be that it's neuropsychology isn't what they need right now, and I'm happy to talk about this and recommend who it might be relevant that they see, whether that be a neurologist or a psychiatrist, or whether it be that they need to see a neurologist or a psychiatrist first before a neuropsychologist, or vice versa. As no one brain injury is the same, even when there are those commonalities, and no one person's the same. So it can be very difficult to know what's the right avenue for my client at this time, and I'm always happy to have a chat about that.